Hi, Mr. and Mrs. Smith. My name's Lisa, and I'm a nurse here at Seneca Hospital. My colleagues tell me that you're upset and you're looking to be discharged. Can you tell me what's happening?
What's happening? I want to leave, and none of these nurses will let me eat or drink anything, and I'm starving, and I don't want to be here anymore.
Tom, please just stay calm. You need to have the surgery.
Tom, I can certainly understand your frustrations and why you're afraid. What would you like me to do to help you?
I just want someone to explain things to me. I don't understand what's going here and why I need to take off from my work. And I don't know why these nurses, they are not letting me to eat or drink anything.
I'm so sorry this is happening to you, and I can understand how scared you must be. Why don't I explain the cholecystectomy process to you and your wife a bit so that you can understand what's happening, and then maybe you guys can make a final decision.
Yes, I think that would be very beneficial. Thank you.
Perfect.
Yes, please.
Awesome. So due to your condition, Tom, Dr. Steffens has chosen to perform what we call a traditional open cholecystectomy, which will be done through a larger incision in the upper right part of your belly. It will be 4 to 6 inches in length, which I know sounds pretty scary, but it's definitely the best approach that we can take to help with the removal of the multiple large gallstones that you've developed. It'll help treat your pain and the symptoms that you've been experiencing, your wife told us, for the past few weeks. Cholecystectomy consists of removing your gallbladder. So Dr. Steffens will likely insert what we call a T-tube to help ensure adequate bile drainage during the duct healing afterwards. Do you understand what I've told you so far?
I think I just want to repeat, you just mentioned the doctor will use a large incision to remove the gallstone, and he's going to use and insert a T-tube to help with the belly drainage and healing. Yeah, I think this is what you mentioned.
Yes, please tell us how this happened to him.
Yeah, so that's definitely right, Tom. You're in great hands with Dr. Steffens. And Mrs. Smith, gallstones are formed when the bile stored in your gallbladder hardens. So this can be caused from the bile containing too much cholesterol, bilirubin, or not enough bile salts. What's your regular diet like?
Admittedly, we do eat a lot of fast food, and I mean, Tom really loves his dairy and his eggs.
So often foods that are high in fat, fried foods, dairy products, eggs, sugary foods, and acidic foods can trigger gallbladder attacks, which is likely what happened with Tom.
What does this mean for me then? And why these nurses, they didn't let me to eat anything or drink?
So I just want to emphasize the importance of you maintaining a low-fat diet and trying to eat smaller meals more frequently throughout the day. If you're okay with it, I'd love for you guys to keep a food diary so that we can gradually reintroduce foods with fats over a 4 to 6 month period. We need you to limit your fat intake and alcoholic beverage intake if you have any of those as well. During the initial first 6 months post-op, the low-fat diet will help limit the bile and reduce the pain or discomfort that occurs when your body is struggling to digest the fats. In your food diary, I'd like you guys to note any foods that seem to aggravate Tom's stomach or that may cause you diarrhea. So loose stools are common. They may occur over the first few months after the surgery, while your intestines adjust to the continuous output of the bile. As for the eating and drinking before your surgery, unfortunately, most patients who are undergoing a surgery with general anesthetic are not allowed to eat or drink anything before the surgery. This is because when the anesthetic is used, your body's reflexes are temporarily paused. So if your stomach has food or drink in it, it can increase your risk for vomiting. We just want to make sure we take all precautions and that everything goes smoothly.
That makes sense. I think my wife and I could keep a food journal. It sounds like some pretty big change, but I think this was a wake up call for us. I really need to take control of my health again, and I also wouldn't want to do anything to slow down this procedure. I'm really sorry. I didn't mean to get upset, but can I ask another question? Can I know when I can go back to work?
Yeah, so I'm happy to hear you want to work on developing some healthier habits, and being afraid or upset is perfectly normal for what you've gone through. Let's make sure we work together with your wife to feel comfortable with the procedure and the aftercare. And as far as for work, since you have a physical job, it'll take anywhere from 4 to 6 weeks for you to get back. And we'll just want you to limit your activity a bit as your incision heals, and we'll want you on your feet as soon as possible after the procedure to promote healing. We can note any painful sensations and work together to create an exercise regimen for you to get back on your feet in no time. Do you have any questions or anything else you need explained further?
No, thank you. We understand. We will work on keeping a food dietary and doing the exercise you tell me I need to do. Thank you so much for your
Thank you.
time.
Awesome.